I thank the leaders of this bill for the time to speak. I'm kind of flabbergasted at the last talk. I'm one of the physicians in this country that have cared for kids on Medicaid. I've actually delivered over 2,000 babies on Medicaid. I've actually done well child exams. We have the Senate lecturing the president, and we should be lecturing ourselves. The debate on this bill isn't about children. There isn't anybody in the Senate that doesn't want to cover and continue the present SCHIP. What this debate is about is how do we move towards national health care. That's what this debate is. And so immoral, is it immoral to spend $3,000 to buy $1,500 worth of care like we're going to do in this bill? Is it immoral for the Senate to say it only costs $35 billion and then totally take a program that's costing $12 billion a year 5 years from now and cut it down to $700 million and say we met the budget rules when in fact we didn't? That's immoral. What about the children that are going to pay for the deficit associated with this bill? I've actually cared for these kids. My practice has been a Medicaid-based practice and an SCHIP-based practice. The holier-than-thou attitude that if you oppose this bill that you don't care about children is completely disrespectful of those of us who happen to disagree that maybe a better way to cover children would be the Burr-Corker bill, which gives a tax credit to every kid in this country that covers enough to give them insurance and takes a Medicaid stamp off their head, since only 40% of the doctors in this country will cover SCHIP kids and Medicaid kids. So the debate really isn't about the president being immoral. It's not about tax cuts. The real immoral fact of this bill is we're winking and nodding to the American people that we're going to spend $121 billion over the next 10 years, not $60 billion over the next 5, 121, and we have no way to pay for that. We had a $444 billion deficit last year. We could have paid for the war and decreased the deficit if this body would have had the courage just to eliminate duplicate and fraudulent programs. There's no holier-than-thou attitude to go after those programs because they have an interest. And as politicians, we don't want to upset anybody. So it's easy. The greatest pleasure in the world is to spend somebody else's money and to claim it in the name of children. I've been on the ground with children. I've taken care of the poorest of the poor. We have a pregnancy component in this bill. Title 19 now is at 300% in this country of poverty level. We have people dropping their insurance to qualify for Title 19. We don't need pregnancy covered in the SCHIP bill. It's already covered. But we claim that to make the bill better. I have no disrespect for people in this body who claim they want national health care. Government-run national health care. Well, American public, guess what? If you think health care is expensive now, wait till it's free. Wait till it's free. And that's exactly what we're doing with this bill. We can reauthorize SCHIP, and we can make it higher than $5 billion increase to truly cover those kids that are needed. This body rejected an insurance contribution component amendment that I offered that would actually expand further the number of kids. The other point that isn't being made is for every kid that you cover that doesn't have insurance today, you're going to drop another kid from health insurance that's being paid for by their parents, and they're getting no benefit in terms of reduction of their health insurance. So what we're doing is shifting taxes to those same parents to pay for a program twice as much money for the benefit that we'll get for the kids. I'm not against well child exams. I'm not against immunizations. I'd give them out of my pocket in my own practice now for free. They cost me an average of $146 a kid. This is the claim of superiority that somehow you don't want to have this bill is that you don't care for children is gobbledygook. What about the kids in the future that are going to pay for the mistakes we're making? What about the kids who are born today that owe $400,000 on our unfunded liability? We've done that. If we care so much about kids, why aren't we fixing that problem? They're never going to get a college education or own a home, and they're never going to have health coverage because we will have bankrupted this country on the way we don't control how we spend money. So to be lectured and lecturing the president because finally he's exhibiting some fiscal responsibility into the future, and us to play games on the true cost of this program, that's what's immoral. It's not the president being immoral. The fact that it is not our money. It is the people of this country's money. And we're going to decide that we're going to spend money and not tell them what it's really going to cost, because that's what this bill does. In the out years, 6 through 12, the 6th through the 11th year of this bill, we cut this program to $700 million a year. Now, nobody in their right mind will honestly say, we're going to let that happen. So if we're not going to let that happen, how about being honest with the American people about the true cost of what we're doing here? It's $121 billion. It's not $60 billion. Anybody, even the staff admits that. Both the Democrat and Republican staff admit that. For us to sit up here and claim that it's only a $35 billion increase. Well, only a $35 billion increase is a 120% increase in the program. Just a 120% increase in the program. We ought to have a debate about national health care and how we solve the problems in health care in this country. There is a way to solve it. It's to make sure everybody in this country has access and give them the freedom and the power to choose what is best for them rather than us tell them what they have to have. And that's the debate we ought to have. This is a farce. This debate is a farce. It's a farce about saying we want to cover more children when we're really taking children who are already covered and putting them under a government program and then charging those children's kids for the cost of the program. That's what we're really doing. It's not about caring for kids. It's about lying to the American public about what this program really does. So I don't have any hard feelings